Do you want to know how to get the most out of your next visit with your cardiologist? Today, I'm going to share with you 7 tips to do just that. So let's get to it. Hi, my name is 𝗙𝗵𝗶. Here at Underdog Ninja, we focus on 3 things. That's faith, character, and action. We truly believe that those 3 things will help you live the best life and thrive with heart disease. We are on a mission to fill a gap between patient and doctor, where the real living takes place and the hard work happens. We are devoted to supporting you and coming alongside of you during your journey to better health. And if you are new to our channel, go ahead and hit like and subscribe. And if you'd like to see more videos like this, go ahead and hit that bell to get notified when we post new videos. If you've never seen a cardiologist before, or maybe you're reestablishing with a new cardiologist, it could be very stressful and nerve-wracking. So it's very easy to forget all the questions that you may have for your doctor. So our goal here is to help you to establish good communication between you and your medical provider. Let's start with number 1, tracking. Have a record of the last 30 days of your weight, your blood pressure, and your current medications. Take that information and email it to your doctor ahead of time, maybe about a week before your appointment. Then take that copy of that record and make sure you bring it along with you on the day of your appointment. Ask your doctor about those vitals. Are there areas of concern? Or are there areas for improvement, like your weight or your blood pressure? Are there ways that we can do those things without upping your medication or changing your medication? Is there something that you can do yourself to help improve those areas? Number 2, labs. If your doctor has requested that you get your blood drawn, make sure you do that about a week before your appointment. And by this time, you may have seen many doctors, so make sure that the lab is sending it to the correct doctor. And it's always a good idea to keep a personal record of those results. So have them on hand and make sure you take those to your appointment in case your doctor hasn't seen them yet. Once you're in your appointment and you're discussing this blood work, this may lead to a further conversation about your medications, your blood pressure medicine, statins, or whatever, okay? So once you start discussing this with them, ask them if is this medication that you're on, is it something that's long-term? Is it something that you're going to have to be on for the rest of your life? Or are these medications that at some point that you'll come off of? Or is there something that you can do to help facilitate lowering those medications or coming off them completely in the future? For example, like if you needed to lower your LDL or your triglycerides and you change your diet and those numbers start to come down, will some of these medications, are they relevant? So that leads me to number 3, questions. I realize seeing a cardiologist can be very scary and intimidating. Write down your main concerns and send them ahead of time before your appointment via email to your doctor's nurse or directly to your doctor so they know ahead of time what you want to discuss. Make sure you bring those questions along with you on the day of your appointment. For example, if you had heart stents placed, ask your doctor if there are any other arteries that are showing signs of plaquing. If you've had a heart attack, ask your doctor if there's any damage done to the heart muscle. Are there any lasting effects to your heart? If so, is it possible to regain any lost function? What's your ejection fraction, your EF rate? Okay, I know that you may have never heard that word before. What is ejection fraction? Ejection fraction is the percentage of blood that is pumped from the heart during each beat. Why is that important? EF is the key indicator of heart health. This will help determine your treatment plan moving forward. So what's normal, below normal, and low? Normal is 50 to 75%. Below normal is 36 to 49%. and low is 35% and below. If you've survived a heart attack or have heart failure, your EF number should be monitored by your physician on a regular basis. Number 4, taking notes. Look, I know that there's a lot being thrown at you, and you and your doctor are discussing a lot of things. And so it's very easy to forget what he said. So bring along a pen and paper to take notes. If possible, see if a family member or a close friend can come along with you to your appointment. Now, I know because in this day and age, because of COVID, there are still areas that have restrictions for extra people to be at your doctor's appointments, right? So if it's not possible to bring someone along, maybe you could get them on a FaceTime call or instant messenger. See if your doctor will allow that, so this way you could have someone to help you remember what you covered. If your visit is virtual, ask your doctor if there's a way that you could go ahead and record that session. Number 5, symptoms. Discuss with your doctor your current symptoms, and if possible, keep a history of these symptoms. And what do I mean? I mean, is this something new? Or is this something you've been dealing with for a while? Is there something that makes it worse or makes it better? Number 6, tests. Discuss with your doctor any diagnostic testing that you've had recently. And if you're scheduled for any further diagnostic testing or other diagnostic testing, ask your doctor if there's any preparation that you need to take ahead of time. Always talk to your doctor about any concerns that you have about these diagnostic tests. Number 7, goals. Ask your doctor about your treatment plan moving forward and what goals that you should try to achieve before your next appointment. Then use SMART goals to stay on track. Look, if you don't know what SMART goals are, we did a video recently that discussed our method about SMART goals, and I'll link that above here for you to take a look at that. Remember, this list is designed to help you establish good communication between yourself and your cardiologist. There is nothing more frustrating than walking away from your doctor's appointment and feeling just as lost as when you walked in. By doing this, you are helping yourself and you're helping your doctor. You're showing your doctor that you are engaged in your health and that you want to get better and that you have come prepared. These are all good habits to have. This is good habits to just stay on track and to lead towards good health. Hey, before we go, comment below about any apps that you use to keep track of those health goals. I would love to know. So I hope today you found this valuable. If you did, please hit like and subscribe. Share this with someone that you may know that may have heart disease also and is going through something like this. So feel free to share this with your friends and family. And if you want to see more things like this from us, make sure to hit that bell so you're notified when we post new videos.